Thank you very much for the opportunity to be able to talk to you and to tell you more about our Mother platform. It is a smartphone and internet-based interactive system to support the management of women with gestational diabetes. Just for the people on that are joined that do not know exactly where we fit within CSIRO. In CSIRO, we have 9 business units, and as you can see, we cover aspects of research in every field that you can think of, but we specifically fall under the Health and Biosecurity Business Unit. So the Australian eHealth Research Centre is CSIRO's National Digital Health Program for CSIRO. We are a joint venture between Queensland Health and CSIRO, but we do a lot of work outside Queensland as well. We are about 100 scientists and engineers, and then we have a whole bunch of students and postdocs, and we spread all over Australia. So we have offices in Brisbane, Perth, Sydney, and Melbourne. We provide an evidence base for digital transformation of healthcare, or that's the aim that we were formed for. And our success is built on our partnerships with government, with clinicians, with industry, with small and medium enterprises, and more. In our centre, we aim to address the global healthcare priorities as was identified very recently by Deloitte. And if we think of health equity, it's not simply more equitable access to care, but it's the ability to fulfill human potential in all aspects of health and well-being. So that includes clinical, mental, social, emotional, physical, and spiritual. We can just look around us to see the influence of environmental changes. If you just think of the floods that's currently happening and also wildfires, they can dramatically impact on, for example, air quality. So it can lead to more asthma, more cases of cardiovascular disease. As Patrick mentioned earlier, there has been an increase in mental health or effects on mental health. For example, there's more depression, anxiety, loneliness, and even suicidal thoughts been identified. And due to the COVID-19, we've seen a convergence of digital transformation and healthcare delivery models. We also know that there are breakthroughs in medical sciences, for example, genomics, and it's happening all around us. We also know that there's a different focus and that there's more of a focus on public health now, including individuals, but we have to look at wider than just individual care. So within our centre, we have 3 research areas. We have biomedical informatics, so that would be our imaging and genomics teams. We have health informatics, so big data, electronic health records. And then the group that I lead at the moment as acting group leader is health services. And this is where we are improving access to services and management of chronic conditions. Excuse me. So some of the trials that we are involved in the moment, and this is just really a few of them, we are involved in cardiovascular disease prevention for Indigenous populations. We're working with the Jameson Trauma Institute in projects using connected medical devices. We are working in ICU for sleep and also in chest trauma. We've developed a prototype, and actually the hardware and the software for diabetic ulcer foot monitoring, and we worked with clinicians and patients in Mount Isa, and we've just got funding to continue with that project. We have a risk tracking app for cardiovascular disease and for diabetes. We're very involved with a preventive program for stroke, and that is with Monash University. And then the project that I want to talk more about is Mother. And what is the problem? Why did we actually come up with a solution? Is that gestational diabetes is one of the most medical complications of pregnancy. It usually occurs around the 24th to the 28th week of pregnancy, but we're seeing it more and more much earlier. It's associated with short and long-term risks for the mother and the baby, especially if the blood glucose levels are not well managed. And frankly, when clinicians look after a mother, they're not only looking after the mother, they're looking after the health of the baby as well. We have seen, and this is in a few years that I've been working with the clinicians in GDM that the incidence is definitely increasing. One of the clinicians that we work with said, I can't believe it, every month is almost exponential. So they physically cannot cope with the numbers that are coming through the clinics. So our aim was to replace a paper diary that women would normally carry with them with an app. But instead of just replacing the paper-based diary, we built an interactive system where the readings that the women enter can actually be seen by the clinicians in real time, even though it's not an emergency monitoring system. But as soon as I upload their measurements, the clinicians from different disciplines can see that. We also use the smartphone apps to deliver messages and multimedia material to the clients. And then the clinicians can view the data for the or follow the progress of their clients at any time from where they are. Basically, the app is tailored for each person, so it's not a one-size-fits-all. So to create a new patient, they actually select what they want to monitor, and only the features that are selected by the clinician would appear on the person's app. They can use the app to set goals for the clients, and it depends on what they're actually monitoring, how they will set those goals. We also have an interactive portal, so the clinicians can review the data and they can select the graphs that they want to see. So they can custom graphs for stress and blood glucose levels or blood pressure and stress, and then view the data in that way. They can also use the clients can come to the clinician's appointment with the app, and instead of using the portal, they can view the data, or they use the portal, but they can sit with the client and look at the data that's been entered over a period of time. We use links, and those can be tailored for each patient or each client as well. And it totally depends on the service. So we simply provide a vehicle to the different services. It's not a one size fits all for the services as well. They could select what links they have and then what educational material they want to provide to their specific cohort. And then we do have alert settings. So the clinician can set alerts that would then either trigger a message to the client or to the clinician, or it can just be flagged in the portal, and that's totally up to the services. Once again, this is not an emergency service, so normally it's just a message that would go to the client to say you had readings out of range. This is an example of the app. So the app is available in the App Store, but you cannot access it unless you have been given access through the portal by a clinician. So as soon as a patient is created, they will provide a username and a password for them. So once they've downloaded the app, they can log into the app. These are just some examples. As I mentioned, the health measures are selected by the clinicians, and then we also provide, for example, the woman can enter symptoms, and we try and make it as easy as possible. So most cases, it's a drop down and they simply select. But we also give an opportunity, for example, when they enter their blood glucose, they can add a note to that. So the progress, we developed the solution in 2016-17, and then we commenced with a feasibility study at Wetland Hospital here in Brisbane. We had 40 women in the trial, and it was really positively accepted by the women as well as the clinicians. Based on the positive outcomes from our feasibility study, we were then further funded by Metro South and CSIRO to develop the app in different languages. And based on the feedback from our feasibility study, we could improve just the usability of the system. And in 2020, right amidst the lockdowns for COVID, we actually had the commencement of Wetland Mata, because the women couldn't come to the hospital as they normally would. So that was a really accelerator for Mother in those hospitals. We also had a small feasibility study with 40 women in Mount Isa. We recently commenced with Logan. We are about in the next week or so to commence with Royal Brisbane. And there are 3 hospitals in Western Sydney that's actually going to use Mother for hypertension instead of GDM. We are in a negotiation with Monash and Western in Melbourne to also use Mother. And then hopefully very soon we'll kick off in Cairns, Gladstone and Alice Springs. So our implementation pathway for Mother, and this was actually a slide that I prepared very long ago, and that was when we were just busy with a feasibility study. So we completed the Redland Hospital feasibility study. We've up to date had more than 3,000 women using the solution. So we might be looking at a much larger randomized controlled trial. And when we suggested that to Mater Hospital, they said, no, we just want to offer it to every single woman. But we do have in the pipeline, maybe later on, a randomized controlled trial. So we hope to translate it to the wider Australia and even internationally. And for that, we are at present also looking at a commercial partner. And then hopefully one day it will just be offered as business as usual in a variety of hospitals. So our 5-year plan, where we are today, we have our mobile health platforms. We are using smart sensing environments in some cases. We do have telehealth. We have image-based AI, which is very preliminary. But in 5 years, we hope that we can offer the solution as precision health, where we have interconnected devices so that people don't have to enter anything themselves. We are looking at intelligent decision support so that instead of having a clinician having to call up every now and then, that there would actually be AI decision support to assist clinicians in their care. And then also personalized behavior change. It's no point measuring and monitoring everything, but it's really, it would be in our future, we see that there's a intervention specific to that person. So some people prefer a leaderboard, some people don't want to ever see a leaderboard. So we're working on a project where we are going to be able to identify and personalize behavior changes for each person. And then also maybe in future interactive technologies like Alexa or any of the other voice activated solutions. We know there are emerging technologies. Unfortunately, the technologies emerge much faster than we can actually do the research. And we know that there are technologies available to enhance and monitor physical well-being, but we also want to use the emerging information systems to reduce cognitive burden. And how will we utilize these? We know that one size fits all is not true. It does not work in all interventions. So we want to empower individuals to be able to self-monitor and manage their health, because we know in future there will not be enough clinicians around to monitor and make phone calls and intervene. We also want to ensure that the services have the resources to improve their care. And then we wanted to develop individual response profiles and implement customized solutions for all clients. So our goal is to revolutionize healthcare management to enable more personalized, patient-centric care and provide convenient and cost-effective healthcare through compelling digital experiences.